So maybe I guess just to start, why don't you just let everybody know who you are and what you're responsible for in the state of Oklahoma so they know what your work is.
Absolutely. I am Margaret Butler, and I am the CCRT specialist here at the District's Attorneys Council in Oklahoma. And so I go throughout the state in all of our counties. The goal is to have a CCR team, and I sit in on their meetings, help with anything that they need. The big thing that I do is provide trainings that they feel like their team needs, and then any coordination issues, kind of help them brainstorm how to get more people to the table and things like that. I've been in this position since March, and I've learned a lot. It's amazing. We have some really, really good teams here in Oklahoma. So I'm excited to start this journey for years to come.
Well, okay. So since you're the only one on the call right now, and it's kind of like the Margaret show. So, so here's a question. When you say that there are some teams that are doing well, and I'm guessing there's some teams that are struggling, right? How do you define doing well and let's just start there. How do you define what's doing well?
Absolutely. So I think the most basic line is they're meeting consistently, especially, well, what I've heard is that we obviously had a ton of teams. So we have 55 teams throughout the state. However, a lot of them have dropped off since COVID. They're seeing that meeting virtually just wasn't working. People were logging on and then not really being proactive or responding, during the meeting. And so a lot of teams have fallen off. So when I mean that the teams are doing good, that they are meeting consistently, they're having participations during the meetings, and then outside of the meetings, they're actually doing what was asked or what was planned during the meeting, right? And so they are going out to the communities and implementing what they're talking about in the meeting to ensure that victims are being safe.
Okay. So I know you've been in this position since March, but have you sat in on some of the meetings? Like, what are the meetings focused on where people are falling apart, like teams are falling apart? And what are they focusing on in the meetings where people are staying engaged? Is there a different agenda going on?
There is. So the meetings that are kind of falling apart, they're just talking about any updates with the agencies. So each agency will kind of go around and say, oh, we have no updates, nothing's changed. We've had, 3 new people come into our shelter or whatever it may be. It's super quick. Sometimes the meetings last like 10 minutes. And then whenever I sit in on meetings that are going really well, they have huge attendance from officers. They have attendance from agencies. They have attendance from agencies, I mean like shelters, domestic violence shelters, DHS, CPS, healthcare professionals, SANE, I mean, you name it, those agencies are on and participating, and they're all giving a viewpoint of what they're actually doing out in the community. It's not just the basic one-liners of nothing much has happened, we haven't seen anybody this month. They're actually communicating about what has happened and what they did to make sure it worked. And then they're also going back to past meetings and talking about like last month we discussed this, well, we tried to implement it in this month and it worked or it didn't work, so how can we change it or fix it? They're having in-depth conversations.
So tell me if I summarize this correctly, but basically what you're saying is that the teams that are staying engaged are the ones that are doing the work in between meetings and bringing the results of that back so that there's a reason to stay engaged because things are actually moving in a direction. The meeting isn't the boundary of the organizing effort.
Yep.
Is that accurate?
Mm-hmm, absolutely. But okay. I will say it also goes a lot with the organizer of the meeting because she or he is keeping everybody accountable, following up with emails. So whenever you're talking about in your past sessions about like some programs would help if they were paid, that is absolutely correct because this could be a separate job 100%. And so if you have somebody that has a lot of time on the side to keep people accountable and make sure that they are implementing what is talked about in their meetings, that makes it huge for whenever you sit down and have a meeting because everyone has done what was expected of them. However, if you have somebody who's in charge of the meetings and they just really don't have a lot of time to follow up and make sure that everybody's doing what they should be doing, the meeting kind of falls to the wayside because people forget, they get busy. And so the meetings just kind of baseline things.
Yeah, okay. So, so one of the things that I'm hearing is that and this is one of the litmus tests that we have for meetings. If we're inviting somebody to a meeting, it has to have something to do with the job that they're doing. Like they can't come and listen to a bunch of people talk about work that has no relevance to the work they're doing when they leave that meeting, right? So the benchmark is that the agenda has to include everybody somehow and a topic that we're discussing so that everybody has a way to give input, and then that keeps engagement. And when you just talk about updates, then there's no real engagement because nothing's going to happen anyway. It's just a wasted hour, right?
Yep.
Okay, so you heard some stuff in the last couple hours. You took a bunch of notes. What are the things that you think are opportunities for your teams to think about, given what the conversation for the past 2 hours was?
I think it's huge that you were talking about focus groups. And so I've sat in on 17 meetings, I think, in the past 4 months I've been here. And a lot of them, I think there's only 2 teams who actually do something of that scope. We have one team who actually does that. Once cases are closed out, they then meet with the victim or survivor and ask her about the system and what has happened. And they're actually doing that next month. So I'm excited to sit down on that and see how that goes. So
they're routinely asking women whose cases get closed to give feedback on their experience.
Yep, and with that team,
they
have a huge participation with law enforcement, because we've seen that a lot of issues with our CCR teams here in Oklahoma is the lack of participation with law enforcement. We have a lot of small counties; they are spread thin, and with those counties, it's hard to get the participation and change the mindset of these officers who grew up in a system of, it's not our issue type of thing. Whatever you spoke about, you get one call, the next call, I'm taking you to jail because you didn't leave. I mean, it's hard to change the mindsets of those small counties and getting their participation in this. So we have 2 teams who actually sit down and do focus groups. I think that's huge. And that's something that I'm going to make sure that these teams that I sit on are doing those or trying to implement those into their teams.
Okay, so I think it's a really innovative, great idea. If you can routinely talk to women whose cases close in the system to find out what their experience is. Here's what a focus group would give you beyond those, right? Now, I wouldn't stop doing that. If there's an infrastructure to do that, like I would not stop that. That's really good. But what a focus group does is it allows for women to build on each other's experience and conversation and find themes. It's hard to do it when you're alone, just left with questions about your own experience. But when you're sitting with 6 or 7 other people and they're all talking about similar things, that reminds you of something. Well, yeah, that happened to me too. And I didn't think much of it at the time, but now that you say it, it makes me think that, right? And now all of a sudden you have this collaborative conversation about the system where people are building on that conversation within the focus group. And that's gold. When you can kind of create that space. So I wouldn't stop doing what you're doing, but adding focus groups
absolutely
would just really give you different information, I think, than what you're getting.
I'm writing that down.
I'm writing that down. Say, David, anything with Stacey yet?
Yeah, Stacey had to restart her computer, and there's still issues, so we may end up having her call in, but she's working on it. Okay, great, thanks. Just keep me updated. All right, so something else besides focus groups. What's something else that's an opportunity for the CCR work in your state, given what you've seen?
I would say, and I know whenever we talked about this training, we are seeing a lot of people staff ongoing cases, so cases that are currently open. With Oklahoma County, they do it outside of their CCR team. It's called a high-risk team, so that the high-risk team then reports what's going on with that current case to the CCR team, so that the the confidentiality of the victim doesn't get spread to all of these random people, right? The high-risk team is able to kind of condense what's going on with all of these teams, find common issues, and then bring it to the CCR team to help figure out in the system, how can we fix that? So I think staffing cases, I know that's something new within CCR teams. So with the high-risk teams, they're trying to hybrid that and bring it back to CCR teams to help the system as a whole.
Okay, so in your high-risk team, which is becoming a more and more of a thing in different communities, how is it apparent how victims are centered in that design?
What do you mean? Can you
Well, okay, so for example, there's a high-risk team in Australia that I visited, right? And so all these different practitioners are at the table, and when a high-risk case comes in, they make a decision about what she should do. So if he's high risk and has access to her home, the high-risk team will take her out of that space and find her different housing. But a lot of victims don't want that to happen, right? So instead of focusing on what we can do to him, because he's doing this thing to her, they're saying, we're going to do something to her to make sure he can't do this thing to her anymore. But then victims push back because, so she's not centered in that response. So I'm asking, like, when they do what they do as a high-risk team, is there a way that you can tell that besides her confidentiality, which is being protected, that she's centered in that space?
I think, especially in your sessions that you're talking about earlier, they have a good relationship with probation and parole. So they know exactly where this offender is. So it is a lot. I hate to say that it is a lot, like the victim now has to change what she does, where she lives, and all of that stuff, because unfortunately the offender still has a lot of control in that situation. But on the flip side, with these high-risk teams, they have great relationships with law enforcement, the probation, parole, the DHS, the child advocacy centers, so that they're able in those roles to make sure that she's safe in that area. So in regards to if it is an open child welfare case, she's not being held that, oh, well, you didn't keep your child safe because you went back to the man, or whatever it may be. They're seeing it in a different light because they have such great relationships with everybody and they know what is actually happening to her. So it is unfortunate that we do see that the woman does have to uproot her entire life and leave because he has some control over, where he's living and all of that stuff. But at the end of the day, she has better services in regards to the DHS. Even the ADA has more, up to date of what's happening with the case, and then probation and parole is able to tell the team what's going on with him, and they can tell her what's happening as well. Does that answer your question?
So that would be a great example. Yes, you did. Thank you, Margaret. So that would be a great example of sitting down with 20 women who've been through that high-risk process and saying, what worked for you about the way that we've designed this and what doesn't work for you? And if you had an idea, what would you change and why would you change it, right? Because if we design something as a system, right, we typically have system goals in mind, right? We want to make sure she's safe, whether she thinks she is or not. And we're going to make sure he's held accountable. But sometimes the way that systems are designed, government systems in the criminal system typically are designed to impose accountability as a way to get to public safety, right? So if we hold this offender accountable, then we'll get closer to safety because we'll create this deterrence, right? And what can happen in that space is that she loses her center in the process and accountability. So safety becomes how they define it, and accountability becomes the center, right? Now, I'm not saying that's what's actually happening, but that's the thing to keep an eye for, right? When you're looking at design, because design dictates intervention, and how they think about the problem dictates design, and then what they do, right? So
the concepts and theories, if you go back to those 8 methods of all the different ways people get organized to do their work, concepts and theories is the front end of it, right? How do we think about the problem? How do we think about victims? And is it lined up with what survivors need? Or is it lined up with what we need to hold him accountable? And she ends up being on the periphery of that.
Yeah,
right?
and unfortunately, yeah, I think they're seeing that when they are having these teams, these high-risk teams, and staffing them in depth. And so that's why it's great that they're able to turn around and go back to a whole team of people that says this is what the issue is and this is what we're seeing, instead of waiting till after the case is completely closed out like that one team is doing and staffing. They're able to do it simultaneously while the case is open and get things fixed now.
Okay, I want to go back to something you said earlier. You said something about the characteristics of the people who can keep a CCR momentum going. Could you describe the characteristics of those folks versus the people that are struggling?
Yeah, so they are go-getters. They have seen the change. I think it's important that it's somebody who is seasoned or at least has sat in on a team or is super trained on CCR team, so that they can see, so that they already know that this works, that CCR teams work. It's not just a meeting to have a meeting. They've seen the change. They've seen the policy changes. They've seen people go out and do the policy changes and how it has affected victims. A lot of the new teams, sometimes they just have like the assistant to the executive director, the domestic violence, shelter, and she's great, she's excited, but that's hard to then get a team who gets around that, because we, like I said, unfortunately always pick on officers, but they think that we're just sitting to have a meeting. What actually change is going to come out of this? So if you have seasoned people who understand the concept and know that it works, those are the leaders that will have the best teams, because they're able to keep everybody focused and they know that it's in the long run, right? You're not going to see change after the first year, after the first 6 meetings that you have. So they're able to keep people focused for the future and know that if they keep sticking to it, that change will come. And so those characteristics are going to be the people who are hard-headed and they're willing to have tough conversations with people, because these meetings can get contentious, right? You don't just want to walk into a meeting and say your policies suck. You need to have somebody who has relationships with these people and are willing to stick it out. And so just people who are willing to, be there through all the hard days and don't give up, and also aren't pushovers or get their feelings hurt, because you have to coordinate a meeting that can get kind of contentious sometimes.
Yeah. So it's interesting because that's exactly the kind of thing that we see in successful CCR coordinators, is that they can ride the lows as they ride the highs. And you will absolutely have both. Yep. And they also have a way of seeing the future. One thing I would add to it is that they have a way of holding confidence. So if somebody pulls their sleeve and says, hey, I just want you to know, so-and-so said that this is what they do, but in reality, this is what I'm experiencing in the courtroom, right? Okay, I can't go to that other person and say, hey, so-and-so talked to me about this, because then I'm gonna lose my resource, right?
Yeah.
So in some ways, it's like, as a community-based organizer, my currency in the system is my ability to hold confidence, so that people can tell me things that they know are problematic, but they do not want to make their jobs harder. They don't want to lose relationships, and they want things to change. And is there somebody out there I can talk to and I can trust to say, this is what's behind the curtain, I think you should take a peek, right? Then they'll know that I'll find a way to take a peek that will not out them when I even bring them into the equation. I'm just curious about something and I want to figure something out. Can I see how we do this, right? And then you have access. So yeah, I think confidentiality is just huge when it comes to this work.
And I think that relates back, I keep talking about your sessions earlier, but they were so great. When the officer was like, I care about child abuse, I care about it. But unfortunately, it's the sheriff, who makes the decisions. And maybe if he didn't have that relationship with that specific person or whatever it may be, he would have never said that. And then you don't know where the policy, how that's getting construed when it goes to the actual street cops. So.
Right. The other thing you said that the person has is time. So could you say more about that versus the people that are struggling?
Yes, I have gotten just this week 3 emails saying that they are needing to reschedule the meetings because the organizer doesn't have time. Something has come up within the agency or whatever it may be, and they have to reschedule for next month because they just don't have time this month to do it. And with those rescheduling, sometimes that just spirals. Oh, well, something came up this week, we have to reschedule, right? And so having time is huge because consistency is huge in what we do. If there's no consistency and there's no time, especially for the person who's organizing it and keeping all these people accountable, things will not change. And if things don't change, there will be more victims and more deaths, unfortunately. So the more people who have time are the best people to run these meetings and keep people accountable.
So
Hey, Noel.
Oh, hey.
I'm so sorry. I don't mean to interrupt. I do have Stacey on the phone with me, and we'll just do it this way if that's okay.
That's great.
Perfect.
Perfect. All right, Stacey, go ahead.
Thanks, Teresa. Hi, Scott. Hi, everyone. I definitely apologize. I was really just in your last session, Scott, so I'm not sure why I can't get in anymore. But glad to be here any way I can.
Oh, well, great. Georgia Internet. All right. So Tracy, do you want to introduce yourself, what your role is, your job, your role, who you work for, and just kind of give them an idea of the landscape that you operate in Georgia?
Sure, yeah. And I'm Stacey Seldon. I'm with the statewide family violence coordinator at the Georgia Commission on Family Violence. And so we are a state agency. We staff a 37-member commission, which is made up of government and community stakeholders appointed by the governor and state. We have a staff of 8 people who cover the state with various projects around intimate partner violence. And so the particular project I head up supports the domestic violence task forces. Those are the CCR groups in our state. And so what I do is provide technical assistance on starting, developing, and organizing the response to domestic violence in those task forces around the state. And our state is actually divided up into judicial circuits. So that's how our task forces are organized. Georgia has 50 judicial circuits and 42 current active task forces. So those are the task forces I support. And I also work to get task forces started in those circuits that don't have them. So that's the basic slide.
So one of the things that Margaret kind of jumped in, and I don't know, since you were in the last session, are there any things that we talked about in the session that you thought might be opportunities for your task forces in Georgia?
Well, I think the relationship between community-based programs and the government agencies, from what I've seen doing this work, which I've been doing since 2015, that relationship is really crucial to the success of task forces. And that's what I see when all task forces are being successful. I always see that relationship being strong between government stakeholders and community stakeholders. So for example, one of our task forces is chaired always by someone from the community and someone from the government. And I've seen policy change and protocol change be more successful when you have that relationship.
Yeah. What do you see are the differences between, in your state, a successful task force versus one that's struggling?
Well, so one of the things with our groups is that our work is legislatively mandated, but it is unfunded. So save my position, these task forces are made up of stakeholders who are volunteering their time. So that can be a struggle when it comes to keeping a task force going and energized and maintaining momentum, because you do have turnover in membership and leadership positions. What I see with task forces that are struggling is they kind of get stuck in the education and awareness about domestic violence phase, which is very important because you do need that foundation as a task force. But a lot of task forces can get stuck and not actually move on to changing systems that affect survivors and improving systems for the benefit of survivors and their family. And a lot of that has to do with their, work not being funded because they're doing this on top of their regular work. But a lot of stakeholders actually see the benefit in organizing better responses. They see the benefit for survivors, but they also see the benefit in the work that they do. So they also see that this will actually help my job and help me help survivors and help me do what I'm supposed to be doing here. So a lot of people do get past that. But I think that when they don't work together well to actually enact systems policy and systems change, it's because the relationships are not strong or they're struggling with turnover.
Yeah. Okay, so let me ask you both this. One of the things that, I talked about at the beginning of the last session was why work with government if you are a community-based agency, right? With a number of the different struggles that some are historical, some are contemporary in real time, the disappointment, the lack of perceived justice in these cases has frustrated a lot of people in the advocacy community nationally. State coalitions have come out with statements against working with the criminal system. Minnesota was one of them. So what's your perspective on the question about whether or not these community-based agencies should be collaborating with government agencies and why? So Margaret, I'll start with you, and then we'll go to Stacey.
I think that it is so important that they work with government-based agencies because usually officers, they're the first ones at the scene, right? And the community-based agencies are able to help those officers understand the victim's viewpoint. So if you work together, they're able to learn the viewpoint of the victim. And then so on scene and on calls and while interviewing, they're able to have more empathy and sympathize with her more, or even just be able to ask the more appropriate questions, or they're able to hold that offender more accountable, right? They're able to look at it at the victim's viewpoint and not just law enforcement, get it done, arrest, that's the end of the call, right? They're able to understand that there are going to be multiple calls, there are going to be, you're not just going to show up one time to a house, right? There's going to be multiple times. And so collaborating with community-based systems, they're able to have a different lens on how to work with these victims and survivors when they show up to these calls. And then also it goes back to the prosecution too, right? Because they too will be able to work with the victim on a different lens and viewpoint than if they're just, we're here to put the person in jail and that's it. Well, what else accountability is there for whenever he gets out or whatever it may be? And so it's just learning everybody's viewpoint, and you can flip that to the community too and understand the law enforcement side of it and what they have to do and their protocols and all of that stuff. And so it goes hand in hand. You can't have one without the other. And so you need to have these hard conversations and sit at a table and understand how we can overcome things so that they can better serve their community.
Okay, and Stacey?
Yeah, I definitely agree with Margaret. I also want to say, as state agencies, we have certain limitations that community agencies don't have, and vice versa. So we have to work together to somewhat neutralize or alleviate those limitations for survivors. So definitely organizing with both types of stakeholders is crucial. If you don't have both, and if you're not including the voice of survivors as well, you're going to miss something that's going to be to the detriment of survivors, or you're going to have unintended consequences that you don't even think of because you don't have a comprehensive, informed voice. And then we also don't get to choose where and how survivors access the system. So we don't get to just discount this stakeholder and say, we don't want to work with them, because that stakeholder is going to encounter a survivor. So they need to be part of the process no matter what.
Okay. And do you see, I mean, one of the things that I've noticed, because I think this conversation's a good one and it's making us rethink some things about what we do and how we engage, right? So in large metropolitan areas where there is a lot of resource base, they have alternatives that can be organized and developed because they have such a different funding base. When you get into more rural parts of the state, that's where you start finding the panic. Like in Minnesota, you've got directors in outstate Minnesota saying, well, we can't walk away from criminal justice because that's the only place to call. If we're not working with them, where do survivors go? We don't have a foundation that can fund this. We don't have a resource base that can create all this infrastructure. When our shelter is an hour away from where she lives already. So what do you see in more rural setting that kind of exacerbates this conversation about whether we should or shouldn't work with government systems? Margaret, so let's start with you. Sorry.
Yeah, I think you absolutely nailed that. Oklahoma, we are super rural. We have 16 counties that have 20 people or less per square mile. I mean, that's just insane. And we have a lot of counties who don't have those shelters in their counties. And so they're needing to transport victims and offenders across county lines to make sure, that everybody's safe. And so you're exactly right. It's so important that those smaller counties have that relationship with the government officials because they're helping them. These victims would be, unfortunately, I think the death rate would be so much higher if there was not a good relationship with the government officials in those small counties. And usually those counties do have a better relationship because people stay in those counties, right? They're born and raised, they stay there, then they raise family. So Joe went to middle school, with the domestic violence advocate, and now he's a law enforcement, right? And so they have already that better communication. Whereas whenever you get to these more populated communities, it's harder. There's a lot more turnover. In the rural counties, it's usually like, for example, we have one county, the executive director of the domestic violence shelter. Currently, she's been there for 15 years. Her mom opened it, and so she grew up in it. And same with law enforcement, right? The sheriff was the son to the old sheriff, and so you have a good community base. So yes, it sucks that they don't have a lot of services in the community, but they're better responding in some situations because they have a good relationship with each other to ensure that victims are safe.
Yeah, and in Georgia, you've got rural areas, right? I mean, so what's the difference between your rural responses? Are you seeing some of what Margaret's talking about, Stacey?
Yeah, I really resonate with what she's saying about there are stronger relationships in areas where the response is developed and the people are coming together. The relationships can be stronger and more tight-knit. But the contrast is that in those areas, the resources are spread so thin. So say in South Georgia, you may have a domestic violence organization that serves 8 to 10 counties, one organization. So if you don't work together and pool resources and come together and try to form, some sort of safety net for survivors, if you try to silo off or not work with a stakeholder, yeah, it's going to have definitely drastic consequences for survivors. And we have some counties in Georgia where there's not even an attorney on the attorney who's legally certified to work in that county. It's just a very different contrast in the amount of resources that we may have in, say, the metro area than North, South, and Middle Georgia.
Okay, so then the question I'm thinking about is like, one of the things that, and I mentioned this before, New Mexico is considering is finding some state funding for people to do this work. How important would that be in a rural setting versus a metropolitan setting, to have dedicated funding for somebody to do this work when you have such a resource, a lack of resources? Margaret.
Ooh, it would be huge. I think that you would definitely see policy changes where the policies need to change. So unfortunately too, with these old counties, a lot of old policy changes, it's just handed down, nothing's changing. So you might have good relationships with agency to agency when it comes to, you know, first response. But then what's happening after that response? How are we then holding that person accountable? And I think that's where the shortfall comes through. And so if you're able to have a funded person who's able to, I keep saying this, hold everybody accountable, sit down, have these meetings, you know, that take hours and hours, it's not taking up from your original job, you would be able to see change quicker. And these smaller counties would be able to maybe even get funding for a shelter, you know, because that person could help see or maybe work on a grant or whatever it may be to ensure that that community needs the services that they need. Because one person who has a full-time job, you just can't get everything done, unfortunately, with no funding.
Well, and their full-time job in a county with 20 or less residents is probably, you know, a two-person job. Because they don't have enough funding to support two people to do the job. So they got one person doing it. Now you want them to do this on top of it.
Yep.
Yeah. Stacey, how about you?
Yeah, I mean, it would definitely be huge in Georgia. It's something that we've been trying to go to the legislature for year after year, to even if we had some regional positions in those rural areas to start off with, it would be a huge help and a huge impact. Because with the task forces, a lot of times the domestic violence organizations and the advocates take lead, and they're already doing so much in their regular jobs. And then with the task force, you know, it's just hard when you're putting all of that on one stakeholder, and that leads to burnout and that turnover that I was talking about before. So in Georgia, that's one of our main goals right now, is to get that kind of dedicated funding for those positions. It would just make a huge impact in those areas.
So one of the things that I think our agency I mean, I've been with our agency for this is the 22nd year. And so I've seen CCR training done from our first generation of organizers to my generation to the next one that's coming. And one of the things I think that we could have done a better job around is talking about the importance of funding, because David mentioned earlier that a lot of people have interpreted the CCR as a monthly meeting. And I don't know this, but because I hear this so often, I think there has to be a way that a lack of funding for this work has contributed to, it's put a ceiling on how much they can organize, and 12 meetings a year that actually are probably like 8 meetings a year, because a few of them get canceled because the person can't make it, right? So then you've got 8 opportunities a year to change something, because that's all I can fit into my current job, because I'm doing this in a sense as a volunteer on top of what I'm already doing. And I don't have the money and I don't have the time, right? So it puts a ceiling on how well people can organize. So to do what we're talking about in the last 2 hours before this one, as I said, it takes a full-time job. Now the DEIP, when Ellen formed this agency, its primary purpose was to develop interventions in the community. The men's program was one, criminal justice policies was another, DHS policies was another, visitation center, dealing with domestic violence, women's program, like all of those things were different interventions. So we weren't doing as much direct advocacy. We were organized specifically to do what you're all talking about, you wish you had money for. And that's the thing that I think is a really important conversation for New Mexico, is how do we, especially in rural communities that don't have a resource base, fund the time to do this kind of work. And I really think if as I said at the outset, they could set a model for other states to think about dedicating money from the state legislatures to do this kind of work statewide. So any thoughts on that?
This just brings me to a side note. People always ask, how do I get people to the county, to the table? Food, right? Some counties, I mean, just bringing food, providing lunch, donuts. I mean, that's a simple way to get people to meetings, and they can't even do that because they're paying out of their own pocket, right? And so a lot of people apply for grants or they fundraise or whatever it may be. And so, I mean, it's sad, but even the smallest amount of money would help change in some of these communities, but they just don't have it. And so change isn't happening.
So that's a really interesting you say that, Margaret, because I told, when I was, doing this work on the front end of it, I said, I need a budget of $1,000 a year for organizing money. I need to buy the police, Coney Island hot dogs and cheese to bring them all together to talk about something. I need to take this person out for lunch. I don't make enough to do all that, right? Because everybody takes most everybody takes a lunch break. So if you need an hour with somebody, you could take them to lunch, right? Ellen, in fact, Ellen always used to joke that the reason that that she was her weight was a result of all the lunch meetings she had with the criminal justice system.
Yes.
So I completely agree with you. I mean, I was going to the team saying, I need to find $1,000 a year to be able to do this. And if I don't have it, it's really hard for me to do it. So anyway, I kind of jumped in there, Stacey, but any thoughts you have around this question?
Yeah, it's funny when you said the food, going back to the rural areas, they're able to pull together and get that food from local restaurants, from community members, that just speaks to, as Margaret was saying before, the close-knit relationships in those areas. But it is really important, and it is something that we've seen that is a draw to attend the meetings. Because a lot of times when we talk about why these CCRs aren't successful is because a lot of people feel like I'm meeting just to meet. What are we really doing here? You got me here, okay, with the food, but what are we actually doing? What are we actually accomplishing? And if you're just having speakers and education every month, that's fine. But if you're not doing something more, you are generally going to lose a lot of your membership.
Okay. So we have about 15 minutes left. And what I'd like to do is open it up to the rest of the participants with any kind of question. You have three people whose job it is to do CCR work in Minnesota, Oklahoma, and Georgia. What kind of questions do you have given your community? What would be the barriers?
So Scott, I'd like to start with some of the questions that were in the chat. So
good.
Sarah Huser is asking, are survivors in focus groups compensated for their time?
Yes.
Is that true in Georgia and
I will definitely ask though. That's a great question.
So we kind of took the concept in Georgia from Scott and trainings from DAIP. And so, yeah, we do compensate gift cards, gas cards. So whatever the shelters kind of decide, but those are on and even cash as well. So those are the kind of things we compensate with for focus groups.
Okay.
And David, I just want to add to that, in that when we write a grant, we write that as a line item in the grant. So we know we're going to do this many focus groups, and this is what the budget line to pay the women for that, so that we're not trying to scatter and find that sell cookies, after the fact to try and pay the women to participate. So
would you feel comfortable saying what the payment is, like the stipend or gas cards, or how much? Is there a per meeting, per hour?
Yeah, when I started over 20 years ago, it was $25 a session. Now it's $75. And I actually had got into a debate with an OVW grant coordinator about whether that was too much that we were paying. So I won. We got to pay them the $75 a person, but we had written it into a federal grant, so the money was there.
Okay.
But that's the
Thank you for
idea.
blazing that trail as well for us. The next question comes from Wendy Lee of Baltimore. Are representatives from the bench commonly a part of the CCRs, given the focus on policy at times?
Well, yeah, Margaret, how about you in
I
Oklahoma?
have not sat in on a team or aware of a team that has one. I did sit in on a tribal team that I trained a tribal team, and that judge wanted to be a part of the team, but sent their liaison for the training. So I don't know if they're actually involved yet, but that was the goal, was for that tribal judge to be involved.
And Stacey?
So yeah, in Georgia, we actually have a few task forces that have the judge as chair. That's generally when we see the most activity. Some judges are opposed to it. We actually had our state judicial qualifications commission, which is our kind of judicial watchdog agency. They actually wrote an opinion saying that, you know, it is not biased for judges to participate in the task forces, but some judges just make that call on their own. But luckily, we do have leadership from judges in places around the state.
Awesome.
Yeah. So
Okay.
just know that judges are like herding cats. So like in Duluth, we have 8 judges on our local bench, and they rarely talk to one another. They are independent, right? And so most judges are going to resist inclusion in a team because they don't want to be perceived as biased.
Sure.
And that's okay. So what we do is we develop an idea and we go to them and we say, this is what could be coming to you if we execute this. What would you change about this if this is coming to you? We're not asking if it should. We're not asking any, to be part of the design team. We're just saying, this is what we've designed, and is it going to work for you or not? And then they give us our feedback. We go back and we do our work. So there's a way that they can participate without being involved that makes them stay independent. So that's a good question, and it's one to really carefully consider.
Okay. We have another question from Sarah. User, do you have tribal representation on your task forces?
Go ahead, Margaret.
Yes, Oklahoma, we have a ton of tribal representation. That's the first question we ask, is who from a tribe could be on the team. We have 38 nationally recognized tribes within Oklahoma, especially in our eastern area. And we have due to McGirt, a lot has changed. And so absolutely, yes, that is a voice that we want to make sure on these teams.
Stacey?
And we don't in Georgia, we don't have a huge tribal population, although we do have Native Americans, of course, but we don't have any nationally recognized tribes in Georgia.
Okay. And then in Minnesota, yes, we do. So in another county we work in, where there's a large tribal land, that they have representation. In Duluth, the American Indian Housing Community Housing Organization, which is a Native-run advocacy and housing, and they do all kinds of amazing work within their community. They are part of our Duluth-based response, but we don't run the meetings the way that you're talking about them. So if we're going to meet with prosecution about a new policy, we're going to liaison with the ACO in order to be part and get their feedback and input on that particular thing. But we've really gotten away from kind of the large meeting format and really focus on small targeted meetings. But in those meetings, we have ACO's representation, or in another county, we have the tribe's representation, yes.
Thank you. And we have a question from Hannah. Hi, Hannah.
Hi. So I live in a rural area in Michigan, and we do not have a CCR yet, but we are wanting to get started. What are just like some basic starting points or advice, things you could just briefly kind of give me, or even just an idea, like when we're going to be working towards or on our budget next year? Like I heard you say, like even if you could budget $1,000, we're not in the position where we could hire a coordinator right now. I mean, this is just like very grassroots. So any thoughts?
Hannah, could you give us an idea of your location, like not geographically, but just demographically? Like, Is it rural? Is it urban? Is it? Do you have,
It's rural. It's rural. We're in southern Michigan. I think we have 60 people per square mile. We have
okay.
about, yeah. Does that help?
Well, the first thing I would say is make sure you don't irritate anybody. because there's this idea, elephants have this memory, right? Well, the criminal justice system practitioners are like that elephant. You irritate them once, they never ever forget, right? They have to retire. So you're going in, and one of the things that was helpful to me when I started, that Ellen gave me was your access to systems as a community-based advocate is contingent on how useful you are. And if you're of no use, then there's no reason to open the door. So you need to do a lot of groundwork to learn. And the first thing I do, Hannah, is if you had access, start doing ride-alongs with police. You're not there to change anything. You're just there to learn, right? Sit-alongs with prosecutors at their court hearings. Sit-alongs with child protection, or ride-alongs with them to visit a survivor or a alleged offender. Start learning what your local government systems are up against when these cases arise, and you will start to see things, okay? And once you learn about that system and how it works, then you can start having conversations with survivors, because you know now how the system works. You can ask them. So when they come out on a call, and in the average response time is 45 minutes, I'm just making something up. What's happening in those 45 minutes you're waiting, right? What happens after they arrive? What happens after they leave? What things are helpful that you wouldn't want to lose? What things are get in the way of your safety, right? What would you change and why, right? Like once you understand what goes on, now you have a way to ask those kind of specific questions of survivors in focus groups to find out what is the impact of what our community does when a woman calls for help, right? And then that, people always ask me, like, how do you get a police chief to sit down and listen? It's not, my thinking that's going to change things. It's going to be me being able to bring the voice of the people that they're serving when they call them for help, and saying, this is what's helpful and this is what's not. And is there any way we can work together on partnering a change around this? That's compelling in a way that, just you as, an advocate might not be, right? So Hannah, any thoughts?
No, that's great. I think that would be extremely helpful, because of course, as I've heard over the last 3 hours, yeah, and knowing that I was in a rural area, making people upset would not be helpful.
No.
Thankfully, I feel like I have good groundwork of making those connections in our community, but doing those sit-alongs or ride-alongs is a great starting point. So thank you so much. I'm looking forward to doing that.
And Margaret or Stacey, do you have anything you want to add to the answer?
I think that's a great starting point.
Okay.
Yeah,
Right.
relationships are key. And I think that's what you were saying as well, Scott. Just building and strengthening those relationships before you go in there trying to make changes is key.
Claire, I see Claire from Texas is here. Texas is so big that it's your background for your for your picture, Claire.
Hey, Scott.
How are you doing?
My auditing background. I'm good. Good to see you. I was really intrigued by your example about the high risk teams and like them wanting to relocate survivors and survivors not wanting that. And so I was just curious, how common is it for high risk teams to really center survivor needs and or really direct the focus to perpetration? And not to make this question too long, but at least in Texas, I don't see a lot of BIP programs really participating in high risk teams. So that's also another part of it in my mind.
Yeah, and so, my message always is that nobody is closer to the proximity of the problem than advocates working with survivors. Nobody's closer to the proximity of the problem that men struggle with. If we're talking about cisgendered heterosexual men committing these acts of violence, which is the bulk of what we see in a community, these two agencies working together to change the narrative in the community can be a powerful team. Getting them to be a powerful team, though, can sometimes be a struggle because they have the same struggle that the criminal system has. They work in silos. They're not used to collaboration, and they don't know how to help one another because they're not having those conversations. So I think it's crucial that they're a part of the CCR. And I had one person say, if my investment in the CCR isn't putting more butts in my chairs, I got no time and no money for it. Again, it's somewhat of a money thing, it's somewhat of a time thing, but the knowledge they have as a program is crucial to the direction of the work. And whether it's high risk teams or any other kind of team, centering victims tends to be contingent on how strong the advocacy voice is in that CCR. The stronger, so like, for example, I think I was in Georgia. This is a long time ago. Georgia was the head of the CCR. Every agenda item for change were things that would make it easier for the practitioners in the system to do their jobs, not make it easier for the people they were serving to get access to their system, because that's how government systems tend to work. So when you've got that at the head of it, it takes a lot of work to elevate the voices of advocacy so that women's voices that get channeled through them can be the center of the conversation, not the periphery. And then if it's the periphery, then you see this stuff where they're managing victims as opposed to managing offenders. So yeah, that's just a quick answer. And I think we've used up David's.
Well,
we are
in the last 30 seconds here. So I will say, thank you, Stacey. Thank you, Margaret. Thank you, Scott. This is very informative. Really, it could go on for hours, and it needs to. So thank you.
Thanks, Margaret. Thanks, Stacey.
Thank you.